Hi, my name is Bentley. I'm a registered nurse at a small rural community medical center in New England. I work nights as a charge nurse there in the emergency department. We're a small emergency department. We have about 16 beds and then 3 behavioral health beds. And we see about 27,000 patients a year.
How has COVID-19 impacted your work?
I think COVID-19 has impacted my work in many ways. So from our initial patient count, from the moment a patient walks into or comes into the hospital until they leave, that whole process to a tremendous degree has changed. And so what that means is that patients, when they come into the emergency department, are routed or into the hospital really are routed in a certain way. We've reduced the number of services that we're providing from a general hospital perspective, and we're limiting the number of visitors patients can have. And so when people come into the hospital, they're funneled in a certain path. And so they can come in for certain things, but they can't come in for others. But if they're presenting to the emergency department through the front doors of the hospital, they're directed to the waiting room. They're provided a mask if they're not wearing a mask. Our registration staff are asking specific questions with regard to symptoms of COVID-19 to do an initial pre-screen. And then when nursing staff come into contact with the patient, depending on what the patient's presenting problem is, so what brought them to the emergency department that day, or what their answers to our COVID-19 screening are, will depend on the level of precaution and protection nurses take when beginning that assessment, that triage of the patient. We've changed the way we use PPE entirely. So we are mandated to wear eye protection and a mask at all times when we're in the emergency department. And then depending on the patient's nature of illness or what's brought them to the hospital for that day, then we escalate from there. I'm lucky to work for an organization that really values personal protection and workforce sustainability and safety. And at no point have I ever been without PPE. There was a period of time where we did increase PPE conservation methods and kind of parameters with regard to PPE conservation. The hospital that I work for has made a lot of really great community partnerships with a local company to create reusable personal protection equipment. So we actually worked together to take a scuba mask that's full face and put 2 little HEPA filters on top. And so nursing and physician staff can wear that. It's assigned to them. That's their own personal piece of protection equipment for the duration of their employment at the hospital that I work for. That's really great if you don't wear glasses. If you wear glasses, you can't wear that mask, but the hospital made an investment and purchased additional N99 reusable respirators so that everyone has a reusable piece of PPE in addition to face shields and other personal protection equipment. We've always used reusable gowns for contact precautions, so we just continued to use that practice. I think one of the biggest challenges was making sure we had enough negative pressure spaces. And so those are airborne precaution rooms. And the hospital made invested capital, did a lot of work to purchase and implement and develop more negative pressure spaces. So our entire ICU, which is a 10-bed ICU, was converted to all negative pressure spaces. So we only had one negative pressure space in our ICU before COVID-19, and now all 10 rooms are negative pressure spaces. And multiple patient care areas on our inpatient units were converted into negative pressure spaces. And so in the whole hospital before COVID-19, we had 6 rooms that were negative pressure. And as we stand today in May, we have 43 negative pressure spaces in the entire hospital, which is a huge improvement to make sure that we are protecting the rest of our patient population from airborne droplets. We did a lot of kind of emergency preparedness surrounding increasing patient population or patient demand. And so we developed a lot of strategies to make sure that we had enough spaces to care for people. So we went to, there's laws governing what happens when somebody presents to the emergency department. It's called EMTALA, and it means that once someone presents to the emergency department, we can never turn them away. But in order to help decompress our emergency department, because like I said earlier, we only have 16 treatment areas, to make sure that we were sending people and providing people the appropriate level of care, we created a respiratory evaluation center, which was a 13-bed space in our first tier that allowed patients who presented with cough, fever, and shortness of breath with stable vital signs to be evaluated by associate level providers in that space, and then discharge coordination. But that also meant that people who came to the emergency department for a cut or laceration or an ear infection, we could direct those patients to our on-campus, hospital campus urgent care. And so we got a special waiver to allow us to triage patients into the emergency department, but then send them to a different care area to receive care for their emergency department visit. And so that freed up our 16-bed ER to treat severe, unstable patients who present with COVID-19 symptoms, chest pain, heart attack, stroke, things like that, so that we were moving people through as efficiently and safely as we possibly could.
Thank you. I have one last question for you. How do you think,
Sure.
How do you think COVID-19 will change things for you or others in the future?
I think COVID-19 has been, in some ways, a very important lesson for the greater community about what happens in hospitals and the decisions that critical care, emergency room providers, nurses, ICU nurses, and doctors make every single day. But I also think that, or it's my hope that the community will have a better understanding of how integral every single individual is when we talk about public health and protecting each other, right? And so from the simple basis of covering your mouth, covering your nose, and washing your hands, making sure people really understand that that's a really vital thing that each individual does to keep the rest of the community safe and healthy. And so if we walk away knowing that we need to cover our mouth and cover our nose when we cough and wash our hands a little bit more, then I think that's a huge win. And I think that, and hopefully people have a better and a bigger appreciation for public health and its greater implications.
Hi, my name is Brian, and I am a crew member at Trader Joe's in Los Angeles during the COVID-19 pandemic. COVID-19 has impacted my work in the shift from normal operations to the constant reinforcement of local and federal government-mandated procedures and restrictions. Normally working at Trader Joe's, the primary focus is on the customer experience and knowledge on the company's ever-evolving product inventory. Now, although those are still important, my job every day is primarily focused around ensuring the public is following all health and safety guidelines for the benefit of customers and employees alike. Inevitably, this stunts a great amount of interpersonal relations that would otherwise normally be at the forefront of my duties, whereas now social distance is ever so obvious. Another noticeable impact is the overcompensation, or what seems to be the overcompensation, of gratitude from customers using phrases such as, "Thank you so much for working," "Thank you for being here," etc. Whereas under regular circumstances, the same appreciation would not otherwise be shown or considered for that matter. And the reason that is noticeable is the shift, or lack thereof, in the behavior and attitudes of the general public. So I have struggled with determining the authenticity of said customers in this regard. And although this is merely a survival job myself, my place as essential is still evidently temporary and will return to its rung on the totem pole once everyone else assumes their rankings in the workforce. That being said, one thing I wish people knew about working on the front lines of COVID-19 is that I show up for myself. Yes, the feeling of assisting someone through a worrisome and difficult time, or making their day better by just a pleasant interaction, is what is so rewarding about a job within customer service. However, for me, maintaining a normal schedule and going to work full time is what has been allowing me to cope so smoothly with this inexplicable time we're living in. And I think that's also why the excessive thanks strikes me differently, because I'm still receiving it and reacting to it from a standpoint of how things were and always had been pre-COVID-19. For the future, beyond COVID-19, it makes me wonder if or how things will change. I know I have been humbled by this experience through my own gratitude for employment and normal structure. I will worry less about what I don't have and rather live gratefully but still ambitiously under the power of now. I think I speak for everyone when I say our priorities will be ever reorganized to highlight and emphasize what we truly want out of our life versus what we may have been conditioned to prioritize under societal and or competitive standards. Thank you.
Hi, my name is Ron Levinsky. I'm a registered nurse. I've been doing that for over 20 years, the majority of it emergency department, handful of surgical years. And before that, I was involved with emergency medical services. I work at a large and busy hospital in the city of Albany, New York. And COVID-19 has had a significant impact on my career as well as those around me. As far as staffing is concerned, several ancillary staff members have been furloughed or laid off, so there's the financial impact to those people and their families. On a more intrinsic level, the team I work with, my colleagues, we have taken this pandemic very seriously. We're very diligent in our work. I can't say any of us have ever thought twice about coming in for a shift or shied away from patients who have tested positive that we need to care for. We just do what we do, and that's what I believe nurses do. Nurses treat people. And I applaud my colleagues and anyone else who is on the front lines. Did I just say I applaud myself? That's terrible. As far as other impacts, equipment-wise, we have to learn new techniques for using equipment, for distributing patients throughout the department, for cohorting patients. It's changed us. We've put a lot of energy and thought into what we do and how we do it. Actually, it's all good because this is the first time in my lifetime anything like this has ever had a direct impact on my own life, my family's life, and my professional life. And I think that's all a good thing because this isn't the only time we're going to see something like this. Other similar events, pandemics are going to happen. This is our first taste of it, and I believe that it will help us to be a little more prepared in the future. I think it's, of course, things could have been handled differently, but that's second guessing. It's been very difficult and stressful for everybody, for the general public. Just having to wash their hands more often, remembering to keeping their social distance, wearing a face mask when going out to the grocery store or anywhere out in public. We're all going to learn from this. It's difficult, but I don't mind. I'm a nurse. I love what I do. I have a passion for nursing. I don't know what I'd do if I couldn't do this. And I'm always open to any discourse regarding what I do, the healthcare system in general. If anybody wants to get a hold of me, any questions or comments, I could be reached at rondo515@hotmail.com, RONDO515@hotmail.com. And I hope what I've done here is helpful to however this project is going to be used. I'm just looking to help out a little bit. So thank you. Everybody stay safe. Love each other.
My name is James. I guess my official role is that I am a licensed apprentice embalmer. I'm actually finishing up my formal education, my college. This coming week, I'm taking my finals, and then I'll be able to sit the boards and become a fully licensed funeral director. But basically a little bit about what I do at the funeral home is that I do a little bit of everything. I work on embalming cases, I sit down with families, I handle transportation, cremations. I mean, you think about what a funeral director does, and that's what I do. So yeah, that's a little bit about myself. I do work at a funeral home here in the Pioneer Valley. I've been with the same funeral home now for about 3 years. This coming September, I'll be there for 3 years. So.
How has COVID-19 impacted your work?
COVID-19 has not been great for anybody, honestly. In short, I'd just like to say COVID-19 stinks. It's really bad. A large part of what I do is helping families along the grieving process. And right now, everybody is separated from everyone else. What grief really needs is acknowledgement. Not people sending flowers, cards, all of those things are nice, but what grief really needs is people to be able to look you in the eye and say, I acknowledge the pain that you're going through. I acknowledge your loss and your emotions. And with everybody being separated right now, we're not able to have calling hours. We're not able to have any kind of services where there are more than 10 people gathering. We work closely with the Catholic community in the city in which I work, at all of the diocesan cemeteries here in the Pioneer Valley out of the Diocese of Springfield. They've enacted a rule right now that no family at all can be at a committal, at a burial, which really, that stinks. So you can have the cemetery administrator and the funeral director and a priest, and that's it. And then the priest is saying prayers over the body, but without any family present. And while I'm hesitant to talk about closure for anybody, because really the funeral is the first step in the mourning process, but they're not able to get really anything. And it's my job to really carry out the last wishes of the deceased and to organize a memorial that's fitting of their life. And we're having to tell a lot of people no right now. And it's just not in our nature. It's not what we got into the business to do. We got into the business to help people, and we're doing the best we can right now. So, yeah.
What's one thing you wish people knew about working during the pandemic?
A little bit of patience and grace goes a long way. In Western Massachusetts, my job isn't nearly as difficult as some of the funeral directors out of larger cities like New York City, who are having to experience wait times at their crematories of up to 3 weeks right now. Or even as bad as some of the funeral directors' jobs out in the eastern part of the state, in the Boston area. But we're all doing the best we can with what we have. We've seen our cremation rates go from about 60% during a normal time to up over 80%, and most of those are what we refer to as direct cremations, which is a cremation without any services whatsoever. So just understand that this is very real. The PPE shortage is very real. So just a little bit of patience and grace goes a long way when dealing with people who are working on the front line, with healthcare workers, recognizing that funeral directors are dealing with people. We're dealing with the deceased, but we're also dealing with the families who have been in close proximity to the deceased. So every day I go into work, I'm not only putting myself at risk, but I'm also putting my family at risk as well. So just try and take it easy on everybody right now. We're all going through a really hard time.
How do you think COVID-19 will change things for you or others in the future?
It's my hope that people will realize the importance of the funeral ceremony itself, the ritual of coming together as a community and memorializing those who we lose. over the course of the last few years, the last few decades, direct cremations have really gone up. People are choosing not to have any kind of service at all, and that can leave a lot of the people who were left behind kind of in the lurch. Like, they don't have an out, like I was saying before, they don't really have an outlet for their grief. So hopefully, with being told that you don't have the opportunity right now, like you don't have a choice, you cannot gather at all. Hopefully after this is all over, people realize that, hey, funerals are actually really important. Being able to acknowledge each other is really important, and being able to socially gather and really memorialize the person is a very important step.
Sure, my name is Angie, and I own a pizza shop in the Berkshires. Owned it for 26 years, and we do primarily takeout and delivery, and we do have an area seating out by the river in the summertime for beer and wine and pizzas to have by the river.
How do you think COVID-19 has impacted your work as a pizza shop owner?
First of all, I'm there a lot more, just making sure that everybody's doing what they're supposed to be doing, making sure that employees are sticking to all the guidelines. It's impacted us in a good way. We're very busy, and I chalk that up to most other restaurants having to close, and the fact that we are primarily takeout, that we've pretty much gotten that under our belt already.
What is one thing that you wish people knew about working with or during the time of COVID-19?
Working with it, I think, some people aren't understanding when we don't have the pizza toppings or the product that we normally have, only because it doesn't come in on the truck. And most people are understanding, but some people get a little irritated if they can't have their sausage or pepperoni, and that seems to be the biggest issue.
And how do you think COVID-19 will change things for you or others in the future?
I think people are going to be a little more understanding of their physical space, and being a lot cleaner, or not really. I'm not sure. I can't. I'm sorry, Helena. What was the question?
How do you think COVID-19 will change things for you or others in the future, for either your business or for people who are coming in to visit your business?
I also think that it'll help us if we have another situation like this. We'll know how to deal with it.
Well, thank you.
You're
I'm a clinical nurse specialist in the emergency department at the hospital. We are a small community hospital right outside of Boston, and at baseline, we care for the indigent population, some of the most vulnerable, marginalized people. And in my role, I'm responsible for clinical practice in the emergency department. So for nurses, primarily unlicensed staff, but also interprofessionally collaborate with the physicians, the physician assistants.
And how has COVID-19 impacted your work?
I have been a nurse for 40 years. I have never seen anything like this. It is unprecedented, is the word that keeps coming up. It's so trite. So for my role, it's been difficult for me to try to keep up with the current knowledge. It's rapidly emerging. It's changing all the time. People are presenting with all different kinds. We were looking for the travel and the cough at first, and quickly became apparent to us that this is a virus that we have never seen the likes of, and have had to change our practice almost daily based on the information that we're getting. I have never seen such information sharing across the world. I feel like a lot of people, really brilliant minds, are working on this and trying to be really transparent for the most part with some of the science. We are in disaster mode, and there's no such thing as standardized practice in a disaster mode. Really interesting time. I have a new grad residency program, and so we have 2 of my new nurses are 1 month out of their residency graduation. So they are full-fledged nurses in the emergency department in the middle of a worldwide pandemic like we've never seen before. I have 3 that are brand new baby nurses. Yesterday was the first day for one of them. So it's really challenging for me to try to help them understand what they're seeing, because this is, of course, not the way that we do things usually. They're seeing things in a day, in 3 weeks for some of them, that it could take a career and you'll never see what they have seen already. So trying to help them process that is another big part of my role. And then the one other challenge that has been incredibly difficult to deal with is the PPE. We've had shortages, variety of daily. It's the challenge. I have to say the organization is completely committed to the safety of the staff. They do absolutely everything they can to make sure that we are informed and that we are safe. But the shortages are just difficult to keep up with. So we've been really creative. Nurses as a group are incredibly creative. And so far we're making it happen.
What's one thing that you wish people knew about working during the time of COVID or working with patients who have COVID?
So again, I have a very skewed perspective of what the majority of people are dealing with. But so for the vulnerable, the very acutely ill, this is not the virus that we thought, the older, infirm patients. We've had 21-year-olds die, 34, 44, no visitors. So we're the ones that are with them when they die. And then we're the ones to have to inform the family from the car that they didn't make it. That's really tough. The physical, the mental, the emotional toll that this is taking on the people at the bedside is, it's really difficult. And as a team, we'll get through this. There's going to be a lot of people that haven't slept in months. It's going to be a long time for some people to be able to get back to it. And what's really frustrating to me is, not to make this political, but people that they don't believe it. And I understand there's economic considerations, but they will never know what it's like to be with somebody, to have nobody else with them. But what I can see is that we now have some rays of sunshine after months of dealing with really critically ill people. These are people calling the ambulance themselves. They're walking into the ambulance and then dying on the way to the hospital. Some we've been able to resuscitate, and after weeks and months of caring for them, we're now starting to hear we page a code sunshine when a patient's being discharged, and they play Here Comes the Sun over the intercom, and everybody lines up to be able to give them a tribute on the way out. And we're starting to hear more code sunshines, and that is really rewarding. We had a 38-year-old that we were certain was going to die, her 16-year-old, her 12-year-old, single mom, and I just heard today that she was discharged to rehab. And it's stories like that that make you come to work every day.
How do you think that this situation is going to change things for you or for others in the future?
I have to say the emergency department probably was quick to adapt to this, quicker than some other places, because forever, as soon as a patient presented to us with a cough or a fever, we knew enough to put a mask on them. So for us, it was, we were looking for the cough or the travel history, like I said initially, and it quickly became apparent. It's the abdominal pain, it's the chest pain, like everybody was presenting with different things. So now I think our PPE going forward is just going to be a face mask for all staff all the time, and that's really hard. Everybody's nose is breaking down from the N95, but and then the face shield. And we've been pretty good about keeping our hands away from our face. So in the hospital, I think that that's just going to be part of our routine universal precautions. As I said, I've been doing this for a long time. It was before universal precautions. I was working in the intensive care unit when hepatitis was first a problem and AIDS came out, and we didn't wear gloves when we handled patients. And now, like, you wouldn't think about going into a patient room without that. So I think the new normal is going to be a face mask with a face shield for every patient encounter. And then as far as the new normal for the rest of the world, I think that we have to pay attention to the social distancing. I don't feel comfortable going out in public without a mask. I feel like I'm naked. So it's going to be a really long time before I can resume any sort of comfort, like sitting in a crowded space. I like to have my 6 feet for most people. I think we just have to really pay attention to the contact tracing, and we've known that this is coming for a while. We didn't know it was this particular bug, but we've been preparing for this for a while. And I wish that we had been better prepared with our stockpile. A lot of the equipment we got was not what we had hoped was faulty. So I think we need to pay attention more, be prepared better. And all I want is to be able to hug my granddaughter.
Yes, my name is Lou, and I work as a volunteer for a local food bank, going to various grocery stores in the Pioneer Valley of Massachusetts, picking up surplus food from their frozen food storage and bringing it to a distribution point for cities around here that take food from the food bank.
How has COVID-19 impacted your work?
I've been doing this job for about 4 months, just a couple of days a week. And in the first several weeks, the stores had 10 to 15 boxes of food available on a weekly basis. And it took me a couple of trips to see 3 different stores to bring them all to the distribution point. As the pandemic began to have a greater effect on the area, less and less boxes were available at the stores. The stores themselves, of course, were less well stocked. There was a lot of product that we normally would have that wasn't available during those days.
What is it like to be working during this time?
It's challenging, but also heartening. It's interesting for me to see the people who are behind the scenes. You don't often see the folks in the back stock rooms and see how hard they work and how much volume they have to process. It's also challenging to know what they're going through on a daily basis, becoming really essential workers in a food supply that has been showing signs of strain for years, but they've been keeping it going. And just watching the changes in how we all have to operate around with each other. When I go to the distribution point where I bring our foods, all the people there are now in gloves and masks, and they're distributing the food to their clients outside the building under a pop-up tent. So that's a very different sort of feel than it had been originally.
How do you think COVID-19 will change things for you and others in the future?
I think we'll see a lot more of the practices that we're doing now as what we maybe had originally thought would be temporary situations will become permanent. Things like practicing distancing from each other, wearing protective masks or gloves, and being more mentally careful about where we go and how we interact with people, and also trying to process the things that we miss about that, the physical closeness that's sometimes natural in our society and families. And I think the other thing with the job that I'm doing, it really, I think, has begun to show me some of the weaknesses and strengths of the food distribution systems that are important and what we rely on.
Thank you for your work.
Oh, thank you for asking.